Good afternoon. For those who I haven't met, I'm Peter Booth from Ignetica. It's been my privilege over the last nearly a year to support the development of the LBDC strategy. And over that last year, there's obviously a wealth of analysis gone into how we can actually apply some of the things we've been hearing about earlier on this afternoon. And it's my task in the next 20 minutes or so to try and give an overview of that. And perhaps as a starting point, I'll just loop back, I think it probably works very well with the previous presentation, that we know data is big. Some of the numbers are staggering. The sort of things of 90% of all data was created in the last 2 years. Every 2 days we create as much data as from the beginning of time to 2003. But as I think Simon was saying, and only less than 1% of that is analysed. With big data, we of course have the ability to handle those volumes of data. We have the ability to work with the velocity of the data and the variety, whether that's traditional structured data sets or in unstructured forms. But really, I think, again, echoing the comments from before, that's kind of the given. The real challenge is, what do we do with that? How do we apply it? We've heard how, by being able to use big data to predict aspects, whether in any field, but particularly in healthcare, can help us start to look at not just digging ever deeper into what has happened, but an intelligent view of what is likely to happen based on those data sets. And of course that correlates directly with some of the major challenges we face within healthcare, which is great. We've heard some of those examples going through, but the challenge and the real question posed just over 12 months ago was, well, how do we actually start to do something around this? How can we get that potential into a way that's accessible when we take into account all of the real world challenges that are there, be they from information governance, be they from funding, be they from the need to be able to do this on a collaborative basis. And the programme kicked off to really look at that with the partners as shown. In a sense, the journey of that process isn't particularly relevant now, except to say that has really tried to understand many of the things we've been talking about earlier today, to understand what they mean and to understand the kind of strategic variables that need to be taken into account. So through that journey, we've gone from the initial hypothesis around effectively some of the things we've been hearing today, into what could we do about that, what are some of the options and what are some of the constraints, to build that through into an agreed strategy and then through into a deployable strategy. The obvious thing is, what is that strategy? But let me just talk about some of those variables, if I might, before getting to it. I think we've probably heard in the conversations before about some of these things, but let's really just bring them together. If we look at the left, enabling big data, at the bottom of that stack, having the technology to be able to manipulate and handle the data sets and to be able to analyze those elements is very sophisticated stuff and very interesting in its own right. But in a sense, that's almost kind of the given. The challenges we need to really address are beyond that, around how do we actually get to the data sets, particularly in healthcare, where we have very rightly controlled data, but where that data typically sits around the originating organisations, not necessarily around the patient that we need to be supporting. Or if we're looking at a whole, looking at aspects across a community, that again, that data is in different pools. So a huge theme about how do we get access to that data in a controlled and appropriately governed sense. And then what about the expertise to actually be able to apply this? So on top of the tools, the data sciences skills that brings together, as we were hearing earlier on, the sort of statistics, the analytics, the computer science, and the clinical knowledge to bring together the ability to build models, to derive that insight out of those themes. And those higher level parts are some of the really difficult challenges because they're not in plentiful supply. There's funding requirements behind them, of course. But when we come to applying that, I think self-evidently, the technology is just enabling. What makes this interesting, and I think again reflecting the presentation before, is the need to apply to address some of the themes we were talking about, and to get those clinical engagements, the use cases as we've been referring to them, that actually define what it is in a particular setting, means that there is value to be derived and that change can be enacted. There's those in a production sense. So we've talked a little earlier on about readmissions. Clearly that needs to be automated to be able to deliver the information straight to the clinicians that are managing that situation. There's also, so we have that type of productionized use case, but there's also the research aspect of driving straight into the data. But behind all of that, funding and management and a program coordination element is key. So in talking about what is it that we can get to through that big data and the different levels of benefit that can perhaps be addressed. I think if we just look at this a very oversimplified but hopefully useful view of at the base level, subject to resolution of all the IG issues and so on, being able to access the data around the patient or around the community in a safe haven environment is a first key step. That can then be used obviously for research in its own right, coupled with the big data analytics as the next tier, to be able to derive insight that perhaps takes beyond some of the more traditional approaches. And then to the next tier of actually being able to build the productionized use cases that mean that those analytics aren't one-off research requests, aren't having to work over a long period, but can actually work in near to real time, so that insight can be applied with the patient at the time of use. And as we go across that, the different types of uses, from the operational through clinical through different research degrees, will use the capability in different ways. And really within the strategy, we've needed to make sure that that's reflected and that this isn't a singular thing. It needs to be able to address that range of requirements. But across all of those is, particularly if we're looking at clinical and operational use cases, is the need for collaboration to be able to deliver the value of the insight created. And so while talking about collaboration, I think it's perhaps useful to just look at that from two themes. One about what degree of collaboration are we talking about? Clearly right now, and we've heard of some of the examples, and I'm sure that there's many more that have been going on anyway as independent big data initiatives in healthcare and otherwise, which is is great in their own use. Bringing together a core collaboration around LBDC, it really brings the ability to try and address some of the common themes that we have to the right. So accessing common data, as in the data that any of those use cases might need, is likely to be subject to the same governance. Some of it is the same data. Trying to get access to that and manage that as a series of ever-expanding independent use cases obviously becomes a major challenge. Whereas on a collaborative basis, bringing an integrated approach doesn't resolve the challenge, but it brings a mechanism to do that in a structured and hopefully much more efficient way. I think there's also an economy of scale behind that as well, perhaps in terms of some of the facilities, but also in terms of some of the expertise, particularly around bringing together the collective ability and augmenting that ability in terms of data science. And in terms of strategic mass as well, we touched on, or I touched on in the slides before about the need for funding. That is, of course, a fundamental aspect of this initiative. By working together, we get to a scale that is of real interest on multiple levels, but also, I think, particularly supporting funding. It's also about being able to use that scale and the linkage through research right through to clinical practice that gives us a extremely strong base to start building out some of those use cases. And just linking back to the left, whilst there is the core collaboration, what I think we're likely to see and you should plan for is as we go forward, some of those use cases themselves could be other collaborations, maybe internationally or otherwise, depending on the nature of that research project or the particular development of an approach for a particular application use case. So we've worked through those range of variables to bring together a strategy which involves a series of core themes delivered over a phased program. There are big ambitions behind this, but clearly there is a real risk of attempting to boil the ocean. And what we need to make sure is that we're getting early traction, early delivery on use cases, delivering benefit from those whilst progressively building both the capability and the funding scope to be able to progress further forward. I'll talk through each of those discs in a moment. But underlying all of those are five enabling strategic themes. One of those is strategic engagement with different parties to bring together the collaboration. And I guess today is very much a first step along that route. Seeking funding on different levels is also one of the key themes. Initially for the program itself, getting the program team together to drive this forward, but around some of the early use cases and ultimately development of the informatics hub. Data sets is of course fundamental and all the IG behind that. But getting initial use cases incubated to the point of a clear business case that can be used as those first deliveries that demonstrate the success is of course a key theme going through. And alongside that, we need to be working through the longer term picture on the informatics hub and analysis, as we'll talk through. But if I just focus in on the middle section for a moment, the core program is about delivering those key themes that I was just talking about. It's about bringing together the focus, bringing together the sign-off of that strategy across the different parties, and it's about starting to get the traction on the other themes really delivered through. Of course, that's not an overnight task. It's a very significant task and one that needs to progressively build forward. So what we have at an outline phasing across those different enabling themes is a series of phased deliverables as we progressively build out the capability, the funding, and those use cases, whilst developing the route for implementation of the informatics hub itself. We have a range of different options behind all of those themes. Linking back to Karen's presentation before, in terms of the informatics facility, we can build that facility, we can engage the people, we can develop that as a core. But that takes time, that takes a lot of money, and actually looking at a facilitated delivery as a service can be a very effective way to get initial engagement forward, and particularly for initial use cases. So those use cases, be it operational or clinical, are obviously a major focus of the strategy. I mean, that's the case for several reasons. One is that is where big data is seen. I think the example was used before of you don't know where the electricity's come to, how it's got to the plug, but it's there. Well, this is the point of plugging in a sense. This is where this is actually used. The technology and everything else behind it doesn't need to be transparent to everyone. The point is it's there and used. So these are the points where we'll actually see the real benefit of big data, and it follows therefore that these are the points that will make the initiative either successful or otherwise. So we need to make sure that we have the right approach in place around the development of use cases to make sure the right ones are developed forward and the right frameworks are in place to make sure they're successfully deployed. And it's for that reason that through the strategy process, we've spent quite some time on developing out a series of frameworks to govern how they're developed, to make sure there is transparency across the collaboration partners, and to make sure that whilst enabling an agile approach within the development of all of those, we also have a series of gated review points to make sure that the right initiatives are getting the funding. Within the early stages of the strategy, what we're anticipating, or what we have as a core objective, I should say, really, is development and incubation of an initial portfolio of use cases that can demonstrate across clinical and operational use early wins, early benefits. And for that to be the case, excuse me, those need to be focused around things where we can get to the data relatively easily, that we can implement in a way that can draw on facilities from Aridhia or otherwise, without being dependent on having to have all of that capability in place in-house. But having said that, the long-term vision is to build through to a jointly owned informatics hub that does bring together the data safe haven, the big data infrastructure, and the data sciences capability to empower and to facilitate delivery of use cases on a progressively larger scale. An obvious question is, well, how does this get funded, and what do the economics look like? And the quick answer is there isn't a single business case behind this, because as we touched on a moment ago, the benefit primarily derives around use cases. So with apologies for the projector not showing the full detail, whether we have any number of those use cases, there is a business case around that. But underpinning that, we have the core program itself, which needs funding, and we have the informatics hub, which needs developing progressively as we go through. Behind each of those, what we've looked at it within the strategy is what are the scales of those elements, and what are the benefits that are likely to accrue through those aspects. But they do need to be worked through for each of the use cases as they're developed as part of the use case development framework. So a lot of complexity, but I think a lot of opportunity primarily. What the strategy should enable us to do, and particularly with the programme being led by Judith now going forward, gives a framework for the collaboration partners to come together, for funding to be secured, for delivery of that strategy to commence. There is a lot to do, but a huge opportunity, as we've heard from some of the earlier presentations. I'm conscious in a very short while whizzing over that there's a lot more depth that you may want to go into. In your packs, there's an overview document that describes the strategy in rather more detail. There's also the LBDC website, which is not dynamically there, but is currently counting down to launch in the next couple of weeks, which will have act as a core source of further information. But otherwise, in questions afterwards and indeed by email or otherwise beyond, please feel free to get in touch for those questions. But I hope that's given a reasonable overview of the strategy as we are now. Thank you.
Thank you.